Hi, I'm Marissa, and my audience member today is going to be my fiance, Sam. The debate of physician-assisted suicide and human euthanasia has been a controversial argument that has raised the question of whether it should be legal in the United States. Many people on the opposing side of the case have labeled physician-assisted suicide being morally unethical since it involves the intent of ending a person's life. But what if that person wanted that? What if they wanted to end the suffering and pain that they're enduring on a day-to-day basis? Don't they have the right to their own autonomy? It's time for a change to listen and advocate for the patient. Overlooking the moral controversy surrounding physician assisted suicide, physician assisted suicide can be viewed as a sanction for ill patients who desire to end their pain and suffering. This is significant because no one should receive a denial of their personal choices, even if that includes their right to die. People should have a right to their own autonomy. I intend to present critical data that expresses the reasoning of why physician-assisted suicide should be made legal and the lack of patient advocacy. Furthermore, I also plan to conduct an analysis that will present laws, opinions, roles, ideologies that surround physician-assisted suicide. Now, to look at the problem. One of the main things that people have the right to their own autonomy. It is the right for a person to govern their own body without any external coercion from anyone. Now, for a minute, let's think. Imagine a person who has terminal cancer or any other terminal illnesses, and they are suffering day in and day out. Should they suffer until they pass? I say no. And therefore, people should have the right and the dignity to die. According to an article from nursinganswers.com, if a patient is given the option of physician assisted suicide, they can choose whatever they want and be respected by their choice. Looking at this further, no one should question a patient's decisions. And this implicates that there needs to be more advocacy for patients. Let's now look at the harms surrounding patients' advocacy. There are many emotional, physical, and psychological aspects surrounding physician-assisted suicide. Looking at the physical characteristics of this topic relates back to the patients. According to an article written by Angela Morrow and RN, she stated that in a Canadian study of 112 patients who received medical assistance in dying, the main reasons people requested included the loss of control and independence, loss of ability to participate in enjoyable and meaningful activities, suffering, and the fear of future suffering. Looking at this, patients not only suffered physically, but emotionally as well, and no one should have to go through that. Patients who are terminally ill are in severe physical pain and should not be suffering, and because of this pain, it can cause emotional and severe psychological damage. Now that I've gone over the problem of physician-assisted suicide, it's important to understand what the cause of it and what is exactly going on. There has always been a debate over physician-assisted suicide of whether or not it should be made legal, and many doctors are against it. According to an article in 2018 written by Yvette Brazier and reviewed by Dr. Timothy J. Legg, they mentioned that doctors may be unwilling to compromise their professional roles, especially in the light of the Hippocratic Oath. The Hippocratic Oath is an oath that doctors swear to never use deadly drugs on a patient. Given this information, it's understandable why physicians must live up to this medical code of ethics. It's to fulfill responsibilities for patients, society, and for themselves as well. But do physicians respect patients' autonomy? When reading and analyzing the Medical Code of Ethics on the American Medical Association website, it's clear that physician-assisted suicide is frowned upon and deemed unethical. But according to the code, physicians should not abandon a patient, must provide emotional support and good communication, provide appropriate comfort and adequate pain control, and respect patients' autonomy. We see a side of why doctors are skeptical to assist patients in that manner, but what about the patient's wants? Don't their rights matter too? Another thing that is important to mention is palliative care, which according to the CAPC.org, palliative care is specialized medical care for people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. Although it's expected that palliative care options should always be addressed to patients, but in some cases, patients are left with little to no information about their end of life decisions. In order to fully analyze the question of whether palliative care would help patients with their end of life decision, it's important to understand the implication of the lack of palliative care in our healthcare systems. Studies have been conducted indicating the lack of care from physicians who do not provide this information. Physician and psychiatrist Timothy E. Quill, author of Physician Assisted Dying, The Case of Palliative Care and Patient Choice, mentions in his book, um, sorry, mentions in his book a study conducted by Dr. Maria Silveira, who specialized in palliative care. She found that patients and families were sensitive to the ways in which clinicians talked or avoided discussing end of life decisions for their patients. What this study presents is the idea of physicians who are unable to provide the necessities and directive information of palliative care. Given this information, a patient has the right to any information about their right to die and what they decide to do at the end of their life. Discussing the ideology of whether palliative care would essentially help a patient not request physician assisted suicide or understand all the end of life options comes down to the advocacy of the patients and the quality of the physician. Now, what can be done to change the laws of accepting physician assisted suicide? Physician assisted suicide is legal in 10 US states and the District of Columbia. Patients are given the option, according to CNN, patients are given the option in Colorado, District of Columbia, Hawaii, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington. And it is an option in California and Montana, but it only granted via court decision. Looking at this, it is not a federal government's decision, but rather a state's decision. One thing that needs to be done is to pass laws in the remaining states where physician assisted suicide should be accessible to terminally ill patients. And that begins by taking a stand for patients' advocacy rights. Patients' rights need to be fought for, and the American Public Health Association has long recognized patients' rights to self-determination at the end of life, and that for some terminally ill people, death can sometimes be preferable. These rights include patients' ability to express their wishes, appoint a surrogate to make care decisions when the patient is no longer able to do so, and to have these wishes honored by healthcare providers. And it also starts with offering proper palliative care. Although doctors have to follow a code of ethics, doctors also swear to advocate for their patients. Overlooking this moral controversy surrounding physician-assisted suicide, this can be viewed as a sanction for ill patients who desire to end their pain and suffering, and they have every right to do so. There's a lack of doctor support, and that can be assumed that doctors are then not advocating for their patients because of their morals and code of ethics they stand by. Patients are suffering physically, emotionally, and psychologically. And looking further at this, we then see why a lack of palliative care is also a clear issue, a loss of autonomy, and that this needs to be changed. As we can see, body autonomy is sacred, and no person should have to fight for the right to die. When a person is in critical health or terminally ill, why must they continue to suffer when they do not have to? Everyone should have the right to their own autonomy, and it begins by changing the ideology surrounding physician-assisted suicide, and it begins by taking a stand for patients' advocacy. Thank you.